really titling this episode What's in the Soup Effect, because I keep thinking about throwing all of these books and articles and concepts into like a big stock pot full of soup that's just kind of constantly simmering away on my back burner mentally. And I'm not quite done with it. It's not done. It needs a few more protein sources, maybe another vegetable, maybe a final squeeze of seasoning. But I thought I would bring this out for discussion because I'm interested in hearing other people's thoughts as well. So I do a lot of reading on healthcare and technology, and I do a lot of reading, period. But I really enjoy published books because they operate on a slightly different time frame than your hot takes on social media, your articles, and so the effort that it takes to produce a book requires maybe a different level of thought, different level of research. It also takes a different level of time to consume and properly kind of assimilate that. So, welcome to my thought process as I continue to incorporate my reading into my philosophy on health, data, and ethics. I have a few items that I've been reading lately that are really kind of influencing my thoughts on healthcare and data and the proper uses of technology in the healthcare ecosystem. And one of them was actually not a healthcare or technology book at all. One of them was Thomas Sowell's Basic Economics, a book which I had not read, and was recommended to me by a friend of mine. And I picked it up, and I could tell immediately that this was going to be one of those books that was an exercise in the productive power of irritation. Basic Economics was a very slow read for me because I spent lots of time arguing with Thomas Sowell on every page. I'm sure he would be devastated to hear this, obviously. Thomas Sowell is a widely decorated, honored economics writer, teacher, professor. Like, he doesn't care what I think. But the thing that I really kept wrestling with, two things really. One is this concept that economics is a science, right? And that the laws of economics are as immutable as any other law of science. And this is difficult for me to really grasp, especially in the healthcare environment, because economics is at its heart about people and decisions, and very personal and political people and decisions. How you make and spend your money is some of the most personal and political decisions that you make. And so I found myself arguing, right, with my desire for people to have good lives without suffering, is somewhat in conflict or in tension with the laws of economics as Thomas Sowell sets out. I've read a few rebuttals of some of his points. There's a lot of discussion about this, but really, I love reading books where I respect the author and at the beginning would disagree with them, because I find that they make me approach my personal values and beliefs, my own code of ethics, if you will, from a slightly different angle. And I often come away with some new insight. So the thing that I was thinking about as I was reading this book, in addition to kind of lots of vigorous arguments in my head, was okay, so let's say that any company that produces a good or a service is subject to the laws of economics. Okay, cool. Let's say that those laws are, in fact, laws of nature and that they are just as immutable as the law of gravity. Fine. We still have building codes, though, that insist that one's house should defy gravity and not fall down on one's head. So clearly, it is possible to responsibly govern around and in collaboration with these kind of laws of science. So that's one thing. I guess maybe my gentle pushback that the forces of the free market are maybe not always the only governing force in the ecosystem. My second thought is that healthcare really is not a simple good or service, right? Healthcare occupies that sort of uneasy space where it is both a good and a service that we are providing, and it is also somewhat of a moral imperative, right? The access to healthcare is a human right. And so we occupy this sort of economic gray space where it is something that should be available to people, and yet we are still operating as a corporation, as a business with certain financial responsibilities, the need to pay our workers, et cetera. And so a lot of the economic policy is really kind of, I'm looking for a really good book on economics of nonprofits and healthcare, I think is the short way to say what I'm thinking. Um, I think it's really interesting to think about the way the forces of the free market and interact with regulation in a way that creates inefficiencies, and yet the free market has created our insurance market, which is also giving rise to a ton of inefficiencies in the healthcare space. I don't have any conclusions or any action items out of this. I have no proposed policy changes. I'm just finding it very educational to continue thinking about this. The second book that I read recently, and I read it back to back with Basic Economics, and so it was a really fascinating experience to see these two kind of set together, was Jonathan Haidt's The Righteous Mind, Why Good People Disagree on Religion and Politics. This is a real touchy subject podcast, so if you're not ready for this kind of discussion, then by all means, this one might not be for you. But I'm really interested in the ways in which our opposing ends of the political spectrum they both tend to put down stakes on the exact same plot of ground, if you will. And that is, well, these are good things to do. These are the choices and the decisions and the actions of a good person. And so often they are actually in opposition to each other, and yet both feel as though they are morally correct. I'm fascinated by this tension. I think it's really interesting. And so I grabbed this book. This is actually the second time I've read it. To try to kind of help me understand the landscape of how people construct their own particular moral narratives and how you end up in a position where you can think, I have made good, moral, and right choices, and somebody else with a different moral compass, essentially, could have been put in the same situation and made completely different choices and felt that they were also good, moral, and correct choices. I found it fascinating. There's a few graphs from the book, which I'm going to try to show right up here. So graphs that show if you're oriented on the liberal side of the spectrum, the libertarian side of the spectrum, or the conservative side of the spectrum, you tend to break down your moral philosophy across a few different axes in different ways. The liberal end of the spectrum tends to give more emphasis towards caring and kindness. Libertarian tends to weight autonomy and liberty fairly heavily. And a conservative approach, actually, according to Jonathan Haidt's research, weights all six axes of moral behavior roughly equivalently, right? So yes, there is value put on caring and kindness. There is value put on liberty. There's also value put on authority, right? And respect for authority. There's value put on equity and fairness in ways that are not quite the same as the way those terms tend to be used on the left side of the spectrum. So I found this really interesting, and I find this multiple moral axes really interesting to think about when we're thinking about healthcare, right? So caring for people is a really easy moral principle to reach for when you're thinking about healthcare, right? Somebody enters our hospital system, they are sick, they need care. We can provide that care. It's caring for people on the very short term. When you start to think about hospitals as manifestations of healthcare policy, and thinking about short and long term, thinking about what are your policies incentivizing, that's when things start to get really interesting and really complex. I don't have any answers here either. I am just kind of letting you know what is bubbling around in the soup pot of my brain. Complicating all of this is the fact that I have been thinking about healthcare as the healthcare that I am used to, the healthcare ecosystem in which I am used to living, right? I work at Cleveland Clinic. I am privileged and grateful every day to work with some of the absolute best clinical minds in the business, some of the best nurses, the best doctors, the most brilliant technical leaders. I am used to thinking of the hospital as a place of innovation and of high academic achievement, as a place where you will go if you want to seek answers. I forget sometimes that the hospital I interact with at work is not necessarily the medical complex that I think about when I'm a patient. So I am very guilty often of feeling a bit off or thinking, hey, maybe something is wrong. And then I think, well, maybe I'll wait 6 weeks and I'll figure this out. Or, in a recent case, maybe I'll wait 2 or 3 years and then I'll figure this out. I don't recommend this, by the way, but I do think it's interesting to think about these kind of two ideas of the hospital system that are a bit in tension with each other, right? So one of them is the hospital as a bastion of knowledge, a place of caring, a place of understanding, right? A place of innovation, right? Maybe a place of first resort, right? And then thinking about the hospital in the sort of like Victorian sense. So I read a lot of fiction as well, and I read a lot of older fiction. So I think about the hospital in almost like a Dickensian sense, right? The hospital is a place of last resort in contrast to the hospital as a place of first resort. And then if you tie all of this together and you start thinking about, okay, well, what technology solutions make sense in a hospital of first resort, right? Where can we innovate? Where can we push things forward? What technology solutions make place in a hospital of last resort? When you turn up at the hospital and the goal is to keep the blood on the inside and most of the air and bacteria on the outside, what can technology do to help out with that? And so trying to put all of this together into one sort of guiding principle as we're thinking about what use cases make sense for technology. Where do we want to be putting our innovation budgets, our IT capacity efforts? What makes the most sense? And I think there's a real desire to go for the shiny, the innovative, the attention grabbing. But I think there is a lot of benefit to be gathered from the not just the items of last resort, right? But all of the bits of the hospital that are not, doctors and nurses and hands-on patient care, but the the nuts and bolts of, how are we getting people in? Is, to return to our basic economics, is our demand truly um, uncapped, or will we hit a point where we have served all of the patients that we can ethically serve? So again, not a lot of conclusions, just a lot of thoughts to share. Thank you for coming along with me on this journey. I am interested in hearing your thoughts as well.